I mean, we have seen some positive effects from ticagrelor in clinical trials, but we have really been lacking real-world data regarding ticagrelor in ACS patients. Ticagrelor is a reversible, direct-acting ADP receptor blocker, and it's more potent, so it has a faster, greater, and more consistent effect compared to previously used clopidogrel. We were using the quality registry SWEDEHEART for this study, and we included all patients with acute MI from 2010 to 2013. The only exclusion criteria that we used was if the patient had used oral anticoagulation or if they underwent bypass surgery during the hospitalization. But so almost all patients during this time period was included in the study. The primary results was that we could see that ticagrelor was associated with a lower risk of death, MI, or stroke, and we could also see that it was associated with a lower mortality, but also we could see a somewhat increased risk of bleeding. So the results were very similar to the Plato results. If you look into RCTs, you can see that these trials really include very selected patients, selected centers, and also even selected doctors. So this is really not the real world that we are looking at. And these patients are usually also followed and managed more carefully than in the real world. So that's why it's so important, because the real world patients, they can differ both regarding how they look like, but also if regarding benefit and risk with this treatment. It was not a surprise. I mean, you could see both in the Plato trial, you could see that there was an increased risk regarding non-CABG related bleedings. And of course, it's a more potent drug, so for me it was not a surprise that you also had an increased risk of bleeding. The take-home message is that these real-world results are very consistent with the Plato trials. So you can say that the Plato results can be translated into the real world, I would say. Our study is reassuring regarding the use of ticagrelor. That's one message, and then another message is to see that it's important that everybody is participating in quality registries, and I think it's important that also other countries have these kind of national quality registries, because then you can really do this kind of studies when you have a new drug on the market.